If you talk to my parents as far back as they can remember, I was going to be a doctor. I even got pretty specific with it. In like fourth grade, I came up with the idea of I was going to be a radiologist. And when they asked why, I would say that it's a really chill lifestyle.
Somebody get this guy some help!
Or, put more simply,
If you need help like this guy, call your own doctor.
Our mental and general healthcare system in the United States is not working. We're living in a crazy medical culture that emphasizes quick fixes in the form of finding the right medicine for our issues, that manipulates research and promises outcomes far superior to what the actual data shows. We prioritize profit over progress. The industry is constantly marketing state-of-the-art new medications and procedures and seeking new ways to reach previously unsick Americans. We tout medicines as cures for biologically incurable mental health problems. Treatment steers us into a never-ending roundabout with no exit ramps. Our symptoms sometimes worsen with long-term treatment using addictive medications. We're lulled into a false sense of security by initial benefits from medications that later lead to our ultimate demise by causing dependence and rebound symptoms that oscillate between manageable and unbearable, correlating with blood levels of our medications. Throughout my training and clinical experience, I've witnessed how the consumerist American medical system pushes 15-minute, fast food drive-through-esque appointments with psychiatrists and other medical providers where the patient relays their symptoms or desired medications at an ordering window, then transactionally receives a medication to numb, dull, or otherwise band-aid their symptoms at the pickup window. And it's not working. We spend almost twice as much as the next highest spending country on healthcare. Yet our life expectancy drags 4+ years behind other developed countries and ranks outside of the top 50 of all countries. Our life expectancy is roughly similar to the Czech Republic, despite spending 4 times as much on our healthcare. We spend 3 to 10 times as much on administrative costs of healthcare compared to any other country. More than 20% of household disposable income in the United States goes towards healthcare expenditures. Yet, despite spending so much more on healthcare every year, we have some of the highest rates of maternal childbirth mortality, some of the highest rates of suicide and obesity, arguably the highest rates of preventable deaths, inarguably the absolute highest rates of drug overdose deaths, and some of the lowest rates of primary care physicians in the developed world. We pathologize normal human experience and convince the American public that routine visits to the meat grinder that is our mental health and medical system are the only solutions. We overdiagnose, overtreat, and overmedicate our society. Savvy consumers of healthcare in this country are correct to question their providers, whether they're simply ignorant of these facts, negligent, or otherwise just comfortable with the status quo. Big industry and hospital administrations, often without clinical knowledge or experience, tout public health measures and novel treatments and medications based on return on investment analyses. Big pharmaceutical companies paralyze progress with their focus on profit margins and quarterly returns prioritized as primary outcome measures. Providers are incentivized by hospital and clinic administrators to provide care to the highest number of patients in the shortest possible time frame, leading to not just suboptimal care, but to poor and uninformed care. And then they are rewarded via end-of-quarter bonuses for meeting their quota, aka seeing more patients, regardless of whether or not their patients are actually getting any better. The system is not built on merit. Providers are not incentivized for good long-term outcomes. In fact, if your patient gets better and needs to see you less frequently with fewer prescribed treatments, medications, lab draws, you are losing the business money. And your contract may not be renewed in favor of another provider who will march to the beat of the profit drum. Insurance companies force providers and patients to jump through a half a dozen hoops in order to obtain a certain medication or treatment, and thereby reduce their own operational costs. This is not to mention the absolute chaotic maze of medical payments and insurance coverage, deductibles, in versus out of network coverage, long wait times to speak with agents, etc., etc. Cheap medications with proven efficacy but lack of profitability are deferred for newer medications and treatments that promise large ROIs. We like to jingoistically exclaim that the U.S. has the greatest healthcare system, medications, treatments, and health insurance in the world. But if you actually look at the data, other countries are lapping us and laughing at us. Genuine progress and understanding of medical conditions, their origins, their phenomenology and symptomatology, prevention and progression, and the effects of life or stress on these conditions all play second fiddle to capital gains. Research is too often manipulated for individual and or corporate profit at the expense of medicinal growth and evolution. The reality of the U.S. medical system is that it operates solely within a capitalist framework where pharmaceutical companies analyze and reanalyze potential profits prior to engaging in certain research or manufacturing new drugs. The perception of progress is more important than actual realistic progress. Obviously, not every person in the fields of medicine, research, or working at big pharmaceutical companies are actively or knowingly working against progress. But there is enough manipulation of the system for individual and company benefit that have stymied progress for decades and will continue to stymie progress for decades to come if we don't demand change. Capitalism is not the enemy, but unfettered capitalism can be toxic to providing good medical care. We have got to stop propping up these profit-driven entities and maybe even divert some of our tax dollars, a small proportion of our governmental defense budget, roughly $800 billion, which is equivalent to the next 9 countries' defense budgets combined, towards independently owned and operated research entities that are rewarded with more governmental funds in a meritocracy-based system. In this series, I invite on a friend of mine, Dr. Taylor Beckman, to talk about some of the inherent problems in the United States healthcare system. We start out learning more about Taylor, then we talk a little bit about the history of insurance and the corporatization of U.S. healthcare, discuss overtreatment in cardiology, in weight loss, and in Alzheimer's, review some of the data on life expectancy, polypharmacy, and the opioid epidemic. Dr. Beckman, tell us a little bit about your professional journey.
Originally from Atlanta, I did my undergraduate degree at the University of Georgia. I went to medical school at LMU DNCOM, Lincoln Memorial DeBuss College of Osteopathic Medicine, and I am up here in Louisville for my internal medicine training. This is my final year of residency, and I'm applying right now for cardiology fellowship. I will interview this fall at different cardiology programs across the country. I find out November 30th where I match, if I matched. If I do, next July, I'll begin cardiology fellowship, which is a minimum of 3-year fellowship. It's funny, especially in these competitive fellowships, people are applying to like 50 to 100 programs, spending like $5,000. It costs more to apply to more places. They're trying to de-incentivize that. But at the same time, since COVID, we're still doing all the online virtual rotations.
Virtual interviews?
Yeah. So people are applying to as many places as they can because they're saying the more interviews I get, the better the chances I have of matching. And this is such a big commitment that it's worth it, even if I have to take out a loan in order to do this.
I know when I started medical school that the 4th year's average number of applications they put in for residency was like
12 to 15.
It's not realistic to have to fly to all these different
No,
cities
no,
and do
no,
it
no.
in person.
My fourth year, 3 years later, that number had creeped up significantly up to 30. And now, what do you think the average number of applications that you submit coming out of medical school for a graduate today is?
That varies specialty by specialty. For the highly competitive ones like orthopedics, I wouldn't be surprised if people are applying to over 50, 60 places. A few years ago, before the virtual interviews, 30 tops. But now I applied to 50 to 60, and I was on the lower end. If it's not going to cost you that much more, you might as well apply to more. And I was a pretty competitive applicant too. So the virtual interview thing has a lot of pros, but I think the cons are definitely weighing on us heavily. And it causes this process to be probably way more stressful than it needs to be.
It also makes it a lot more difficult if you're not as great of an applicant, because in the past you've had to travel to each residency program all around the country, and that shit gets expensive really quick. Now you've got really good candidates that are casting a really wide net, and then those programs are going to rank those really good candidates. And a lot of programs, if they're not keeping up with the numbers and keeping up with the times, then they're going to have a limited number of applicants that they actually rank.
It's funny you mentioned that. When I was applying to residency, I was the first year coming out of medical school that we had these virtual interviews. And come match day in March, it was the first time in like 40 years some of these top programs had to soap people. And I'm speaking just for medicine, but I think it happened in other fields as well. But Duke and Hopkins, and they fell into that trap where they had all of these people. The top 15% of all applicants were applying and getting every interview they had. If you're applying to 50 programs, you're getting 50 interviews. All of these places are ranking the same 15% people, saying, okay, they're going to come here. And there's just not that many people in that top 15%. They rank all those people, and then they had unfilled spots that they had to soak people into. It was a little cathartic to see.
How did you make the decision, or what was your path to going to medical school in the first place?
I feel like a lot of people applying to medical school have some like aha moment. One of their family members got sick. They saw someone on the streets have an accident. I never really had anything like that. If you talk to my parents as far back as they can remember, I was going to be a doctor. I even got pretty specific with it. In like fourth grade, I came up with the idea of I was going to be a radiologist. And when they asked why, I would say that it's a really chill lifestyle.
Fourth grade, ready for that chill lifestyle. What'd you study in undergrad?
I was a biology major. I had an emphasis in neuroscience. University of Georgia, Hope Scholarship, which was great. As long as you carry a 3.3 to 3.5, school's paid for in the state of Georgia. Being a large state school, you're in these pre-med classes with hundreds of other people. So there's not a lot of individualized attention. Definitely prepares you for at least teaching yourself. There wasn't a lot of help as far as pre-med advisors. There's hundreds of us and maybe 2 pre-med advisors for the whole school. So I had a difficult time navigating that world, finding the correct MCAT stuff to do. And it actually took me 3 application cycles before I got into medical school. And it wasn't for lack of test scores or GPA. It's just become very competitive. And sometimes it's kind of the roll of the dice too. I had interviews at a couple places. Some of those interviews didn't go as well, which is a whole other topic that people during these medical school interviews are trying to play psychological games with you. Which is,
I know, it's kind of wild. Did I tell you on the psychological mindfuck when I was doing my interviews for residency, which was way back in the day when we used to go to the school? Luckily, I really had no interest in going to West Virginia, but I drove there and I woke up that morning and I realized I don't have a tie. And I asked at the hotel, like, where's the closest Walmart or somewhere that I can get a tie? Oh, it's 45 minutes away. And I had to be there in 30 minutes. So I'm looking around and I see the bellhop. And I'm like, hey, man, I'll throw you some money. Can I have that tie? I'll even bring it back to you when I'm done. But I can't show up not in a tie when everybody else is going to be in a tie. So I borrowed the tie. And I go in there and you have a bunch of individual interviews that you do with the program director, the assistant program director, other faculty, sometimes a resident, upper level resident. my first interview was with the program director. And the program director's like, I read your personal statement. It's essentially this story that I call the pirate story. It was told to me in a high school 45-minute religion class, actually. The first 22 and a half minutes or half of the class, the teacher detailed this whole tale about this pirate and how evil he was and all these horrible things that he would do. Then in the middle, he asks everybody in the class, what do you think of the pirate? And everybody's like all up in arms. They're like, fuck this pirate. Like, it's a horrible person. They don't deserve to live. And then the second half of the class, he tells about the pirate's father. And he details an even worse individual. And actually, the original pirate is very tame and mild compared to his father. Still doing some bad shit. So I detailed that in my personal statement.
Yeah.
As going into psychiatry and mental health and being like, there's a story for everything. There are reasons why we are the way that we are. Blah, 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 blah. I go into that first interview and the program director's like, yeah, your personal statement, I just don't get it. And that's how he pretty much starts off the interview. So I'm already nervous. I didn't bring a tie. I had to borrow it from the bellhop. I go into that interview.
Was it like a normal looking tie or was it like...
I mean, it wasn't the nicest tie, it was a little thin. It was all I had, right? I literally am in the lobby of the hotel looking around at people. Who am I about to ask for a tie? That one obviously didn't go very well, and it's with the program director. And I'm like, well, it's a good thing I didn't plan on ranking this program very high, and whatever, it'll be a learning experience. I go into the next one, and the assistant program director starts out with, the thing about personal statements. And I'm like, oh, fuck. I'm like, not another one. Like, I thought it was pretty good. I thought it was pretty unique. And he goes, about 10% of them are complete red flag. And they tell me that I definitely shouldn't entertain the idea of ranking this candidate. And about 10% of them are so good that it really boosts you to the top of the rank list. And then the other 80% don't really matter. And I'm like sitting there kind of smiling. And he goes, yours is one of the best personal statements that I've ever read. And I just start laughing out loud. And I'm like, the program director just told me that he didn't get it. That was a fun interview.
I've been told about personal statements because I just had to write one. My program director now said the difference between the 10% of the best ones I've ever read and the 10% of the red flags that I'm not going to interview, there's a very fine line in between those. And sometimes it's hard to tell the difference. Just be boring. That is all the advice on personal statements. Just be boring. Don't be unique. Don't try to stand out.
So if you could go into the completely ideal job situation when you're done with all of this, 3 years cardiology?
1 more year medicine and then 3 more years of cardiology and possibly more if I continue to further train. UK actually has a program where I do an extra year after 3 years of cardiology and I could get boarded in critical care. That's not completely necessary to do critical care with cardiology. You can run a CCU, but in order to kind of be on your own and managing ventilators, you would need that extra board certification. And you do other things like chest tubes and stuff that you probably wouldn't as a cardiologist running a CCU. The other thing that I'm entertaining now, maybe I might not in a couple of years, is a sub-fellowship called electrophysiology.
Taylor, tell us a little bit about your personal journey in life.
Since I knew I wanted to go to medical school at a very young age, I think that became a pretty big driving goal and almost part of my identity before it happened. And I definitely struggled a little bit when I didn't immediately get in, and especially when you have other friends getting into. So after college, I actually had to take a couple gap years. I took a research job doing clinical research, working with a nephrologist, which is a kidney doctor, and a family practitioner. They were doing phase 2, 3, and 4 drug trials, working with pharmaceutical companies. I got a pretty good look into what it takes to get a drug approved, how that process works, how do drug companies find out side effects. It definitely showed me kind of behind the veil of the pharmaceutical companies, and their ultimate goal is to get these drugs to market. Their ultimate goal obviously isn't always patient safety. There's some great people that work in the pharmaceutical industry, but the main driver is the money. I had 2 years in the meantime applying to medical school, interviewed for a couple places. It wasn't until my third year of applications that I started to apply to DO schools. I eventually ended up at LMU DCOM in East Tennessee.
I had a similar experience trying to get into medical school. A very tumultuous time in my life, actually. It was 2013, and I worked in a research lab. I didn't see so much the drug approval process side of things, but what I did see was a couple of kind of head researchers bolster their resumes with research, people that were just trying to publish anything that they could, coming to conclusions that the research did not actually support. 2013, I had guaranteed entrance into medical school if I met certain MCAT and GPA requirements in this postgraduate program. A month before my last semester there, as I am going through the application process, my brother passed away. Yeah. And I fucked up my finals. It was literally a few weeks after that I was taking finals for my courses, and my GPA slipped below the number and I didn't get in. And that was just devastating, which in hindsight, it's a good thing. I was not ready at that point in my life. But yeah, that weight trying to get into medical school can be very heavy.
Yeah, definitely. As you said, some tumultuous times. Probably drove through some depression because of that. And you realize that maybe you need to stop tying your identity to one of these careers so much that not doing it would cause you to feel so disappointed in your life. I was not ready to get into those other times. I learned a lot doing some odd jobs, working as a researcher. I did a lot of traveling, did some medical volunteering in Vietnam and Asia. And I think those opportunities set me apart from my colleagues in medical school. Because when you go in straight through from college, I definitely saw a different attitude that
some of them were still in the frat.
Yeah.
Or the sorority. It was
exactly.
It was this big social outing, and I got there and I was 25, 26, and I'm like, no, this is my career.
Yeah, like this is my profession. 9 to 5, you're like, oh, this is the real world. Working 9 to 5.
I think it also allows you to step back and look at the value of why you wanted to do that in the first place.
Exactly.
Sometimes we get so attached to the goals that we set out in our heads, or identify so much with the goals, that we get to the end, we say, oh, I didn't get into medical school. Okay, but you didn't want to go to medical school so that when you're 80 and you're on your deathbed, that you can say, I went to medical school and that is who I am. No, that goal is so secondary. So it gives you that time to dig into, why is this important? Oh, doing something meaningful in my occupation is the important thing to me. It's not even necessarily medicine. That is one of the biggest things that I value, is having meaning in my professional career. Oh, shit, hold on. I could not get into medical school and still find meaning in my professional life.
Yeah, that realization definitely hit home after getting a few rejection letters, and makes you a lot more comfortable with you as a person in general. And I don't think I would have gotten that experience if it wasn't for that time. Then you can go into what's driving you at that point. Is it just the fear of failure that's driving you? And I think a lot of people, that is their main driver, is I don't want to fail. I don't want to be seen as a failure. I don't want to consider myself as a failure. Instead of really finding, what do you want to do, instead of what are you driving away from instead.
What about before that? What did your parents do?
So if we want to go way back, the reason I originally moved to Atlanta when I was about 6 months old, my dad was in the ground level of the restaurant chain Ruby Tuesdays. So one of his college friends started that chain, and he lived up in Knoxville at that time, eventually moved to Nashville, became regional manager. He eventually had to relocate to Atlanta and manage the branches they were opening up in Georgia. So I actually grew up in a restaurant. He was working all the time. Eventually, they went public as a company. He thought it was a good time to get out and start his own restaurant, as anyone that works in the restaurant business wants to do. Unfortunately, he opened his restaurant at the same time the recession hit.
Ooh.
We lost a lot of money in that, but I grew up working in a restaurant. Another thing I think should be mandated for everyone at least 1 year working in the service industry, because you realize how many people are assholes, and you realize not to be one of those assholes. Eventually, he had to have some back surgeries due to just being on his feet all the time and some bad degenerative disc disease, and actually went on disability because he got addicted to opiates. We were in Atlanta at this point, but this was the prime time for
Prescription?
Yeah.
Yeah.
Prescription opiates. Yeah. Back surgery didn't work. He had an L4, L5 laminectomy. He was in pain all the time. At that point, we didn't know much about treating back pain. We just threw opiates at it because that's what the pharmaceutical industry gave us.
Yeah.
And said, you need to treat pain. It's
This shit's not addictive. This is not anything new.
It's been shown in history throughout. But he fell into the trap, and he didn't work much when I was in high school because of that. My mom picked up the slack. She was a real estate agent at the time, started working some extra jobs, and carried us financially through high school. But there were some tight financial times growing up, which definitely affected my older brother and I think was another driver of me going into medicine. Hopefully people don't go into medicine just wanting to make money, but there is a lot of financial security involved in this career. And I viewed that in a very positive light going into it.
I'm curious, how did you view the financial insecurity that your family was in at that time, how it affected you then, versus how you view that situation now?
So back then, just tried to ignore it as much as we could. There was a few times when I vividly remember conversations with mom saying that we might foreclose on the house this month. And as like a freshman in high school, that's a lot of stress to be dealing with. But we didn't talk about it. Everyone just ignored it. It manifested in different ways in my brother and I. I think he was a lot angrier, and he's 6'5", big guy. Me and him didn't have a great physical relationship growing up. I wasn't small by any means, but when we got into a physical altercation, even though we were like 13 and 15, it was a big deal.
I had some of those growing up.
I know you come from a family with a lot of brothers. But back then, I think the way it manifested in me is I really started to develop a pretty serious work ethic. Instead of dealing with those emotions and the stress, I channeled it all into work, which was at that time sports. I was constantly working out at all the football practices, thought I was going to play college football, and ended up being recruited a little bit by Vanderbilt. Didn't get the offer, but they invited me to walk on, but they're a $60,000 a year program.
So I guess back then, did you view that as a hindrance, as something that could set you back?
Yeah, I did. I viewed it as something that limited my options. And I grew up in the suburbs of Atlanta, Roswell, like North Metro Atlanta. You definitely still see a lot of the city, but it is a little more affluent area as well. So I saw people around me with more opportunity than I had, even though I had a world of opportunity.
Monetary opportunity.
Yeah. And when you're a 16-year-old and that's all you're seeing are the people around you, you don't have a good worldly point of view yet.
Yeah.
So there was a little bit of frustration, a little bit of blame, and I did view it as a hindrance. But as I started to get older, I was always working through high school, college, always had a job, always had a hard work ethic. If I really think hard about it, that financial insecurity had that effect on me. And I don't want to say positive versus negative. It's just a thing that happened that affected me in this way. But the consequences of that, I do view in a positive light. Me always feeling like I have to have a job in a bad financial spot has given me such a wide range of experiences, having all of these odd jobs in a wide range of different populations, working with different people, that I feel like I'm able to troubleshoot problems better, interact with people better. And when something's going wrong or I don't know something, I don't really sit around and wait for someone to figure this out for me. I find it a lot easier to stand up and figure it out myself. It's one of those things that's sucked going through, but I'm grateful that I had the opportunity to have all of those different work opportunities.
But it's also imperative for you to have experienced that to become who you are now. We have such a tendency to judge things in the moment. But if we can remove ourselves from that judgment and recognize that I'm probably going to look back on this later and have a different, probably more full perspective on it. I had more superficial financial hardship because my parents, especially my dad, came from a very poor family.
Yeah.
A single mother family. 4 kids. His dad died when he was 6 years old. And so he drove that point home to what I thought was a flaw. I felt ostracized and saw my peers getting things that I didn't get, but had a dad that was pretty fucking hard on me. Corporal punishment was definitely a thing, and there was not a whole lot of positive praise or go to the basketball game, score 30 points, 10 rebounds, and it's like, well, your defense sucked out there. But what I realized many years later, and some dark times between, is that also created the drive that I have now to do things. That is my motivation. Yes, I do struggle with feelings of inadequacy to this day, probably related to that. But at the same time, if I didn't feel inadequate sometimes, well, then I probably wouldn't have the same drive to go and do things. Like you said, it's not good, it's not bad. It is what it is, but it's a much fuller perspective and more complete understanding of how those influences shaped who I was. But it's funny how we look back and we view things that happen in our lives drastically different than we did in the moment.
And that drive that we're both talking about, amongst the most quote unquote successful people I've met, that drive is something that a lot of those people have. And if you say, would you go back and change it? I think most of those people that have that drive wouldn't, because they recognize that drive is what got them to where they are, the success that they've had. And even though it might have meant maybe a little bit of trauma or negative experiences, if you want to say that, earlier in their life, it's probably worth the lessons they learned.
This podcast is for informational purposes only. The information provided in this podcast and related materials are meant only to educate. This information is not intended as a substitute for professional medical advice. While I am a medical doctor and many of my guests have extensive medical training and experience, nothing stated in this podcast nor materials related to this podcast, including recommended websites, texts, graphics, images, or any other materials, should be treated as a substitute for professional, medical, or psychological advice, diagnosis, or treatment. All listeners should consult with a medical professional, licensed mental health provider, or other healthcare provider if seeking medical advice, diagnosis, or treatment.
Or, put more simply,
If you need help like this guy, call your own doctor.
Thanks again for watching and or listening. If you're passionate about the subjects that I discuss on the channel, do me a favor and like, comment, subscribe, do whatever you can to make your voice heard, that these are problems that must be addressed in our society. If you have any questions, comments, or concerns, I want to hear them. Feel free to reach out on social media or email us at renegadepsych@gmail.com. And if you'd like to be a guest of the show, or you have a connection to somebody that you think would be a good guest, let us know. Thanks again for listening.